So the first talk that I was asked to present on is tricks for the obese patients in colorectal resection. So I would like to present about how big of a problem it is, which probably is obvious to most of the audience. Some comments about use of minimally invasive technique, which obviously and by force will not be exhaustive, and then some comments about techniques of stomach construction. Everybody can find themselves when they're on call taking care of difficult patients that happen to have urgent or surgical conditions associated with obesity, and this is to me one of the most important aspects of learning how to create an appropriate stoma. So obviously, there's a lot of people who are obese, and what is obvious is that obese is also not created all equal. There are classes of obesity, so I'm about to become obese if I don't pay attention, but there's a class 2 obese patient who has a BMI from 35 to 39.9, and in this NSQIP database on almost 75,000 patients, over 8% of these patients had that kind of body mass index. And there was also a 5.5% of patients that had a body mass index exceeding 40 kilogram per square meter. And in my personal opinion, that kind of obesity is different from an obesity of a BMI 31. When you practice, you have to decide differently according to that. Not surprisingly, there's increased odds of surgical site infection after surgery, which goes along with obesity class when compared to normal weight patients. And class 3 obesity was associated in this study with the highest risk of sepsis, respiratory, or renal complication. When we add diabetes and hypertension in the so-called metabolic syndrome, the work from the Rochester group, which included Dr. Matthews as a co-author and Dr. Larson as a co-author, indicates that metabolic syndrome was significantly associated with renal complication, superficial and deep SSI, wound dehiscence, and unplanned readmission. So obviously a very significant problem. And as we now do laparoscopic surgery as a routine, there's also data specifically tied to the issue of using laparoscopic surgery in this patient population. And so this is a meta-analysis from McGill University and on 13 studies and over 4,500 patients, all obese starting with a greater than 30, so any category